All right, Assalamu alaikum, good everyone, and thank you all for joining us here today. I'd like to welcome everybody on behalf of the Mohsen Fawzia Jaffer Center for Muslim World Studies at Florida International University, as well as our founding director, Dr. Mohit Bahi, who sends his warm wishes. And we'd like to welcome you all to our Zoom webinar today on COVID-19 and the Muslim American community's grassroots response. My name is Hussein Negamiya. I'm the Senior Program Coordinator for the Jaffer Center, and I have the pleasure of serving as your moderator for today's event. As we know, the last 4 months has really taken everyone by surprise as we continue to deal with this global pandemic, especially as we're beginning to see record increases in our very own state of Florida. We really are in unprecedented times, but sometimes it's how we react during these challenging times that really shows the strength of community. In Islam, we stress principles of collectivism and community, and we strive to work together to help one another, Muslims or non-Muslims alike. And we've seen some community respond to this pandemic in an amazing way, as well as others. Everything from providing free testing to food distribution, the Muslim community has been providing relief at the local level through organizations such as UHI Community Care Clinic, Cosmos, the South Florida Muslim Federation, Relief, and South Muslim Federation, which is actually a coalition of Muslim organizations and mosques in Florida, such as the Imams Council, Relief, and so many others. And today to discuss the grassroots response by the Muslim community to COVID-19, but also see how we can continue to prepare for the long road of recovery ahead. So with that, I'd like to welcome you all to our amazing panel today. Joining us today, we have Dr. Mohsen Jaffer, who is the President and CEO of Senior Medical Associates and Stallion Medical Management. He is also a board member of UHI Community Care Clinic. Also joining us, we have State Representative Nick Duran, who is the Executive Director of the Florida Association of Free and Charitable Clinics, and is also a member of the Florida Legislature representing the state's 112th House District. We also have with us Dr. Aisha Sabhani, who is an emergency medicine physician and foundation. She also sits on the Board of Trustees for Zayed College and is a board member of Cosmos. And finally, we have Dr. Hussein Negamiya, who is a medical surgeon in Florida. He received his medical degree from college and for more than 20 years. Panelists, I would like to thank you all for being here today and joining us and taking the time to be scheduled. With that, I'd really like to just go ahead and dive right into it if we can, perhaps beginning with you, Dr. Jaffer. You can give us a little bit of a history of the Muslim medical charitable establishment here in Miami, and how have they been responding to the COVID-19 pandemic today?
Thank you. I'll begin by invoking gratitude to that loving creator because we are so blessed in this nation. But after having said that, I feel we Americans were always leaders when it came to problems like this, which is global pandemic. President Bush established a White House task force, pandemic task force. President Obama augmented it and even funded it more. Unfortunately, this administration disbanded it. But we have been the leaders when it comes to WHO, the World Organization, our CDC, Center for Disease Control, would always be in the forefront to handle something like this. Instead, we have minimized it. We have caused a lot of misinformation and disinformation about this disease. And that's why we are in the dire straits we are. If you look at the successful countries, they've done so well because of a very concerted effort, listening to experts and putting resources where the experts said to put in, and they got the results. Today, unfortunately, like you mentioned, Dr. Gumrawi, that we as Florida are really in the epicenter today. And so many of our fellow Americans are getting sick and dying. This is unacceptable. So what has happened now is that there is a very large community of doctors who are Muslim in America, very large compared to the percentage of their population. And they've been frontline doctors, they've been involved, and they have now to correct the misinformation and give the right information so that the general public can respond in the best way possible. For example, today there is a controversy in our country about masks. It shouldn't have been there. About social distancing and about the care for your fellow human being. When you wear a mask, you're protecting them and protecting yourself, but this is your civic duty. We have failed in that. But to come back to the Muslim community, we felt, if you look at the 24 or so congregation, the masajids, they started testing, they started distributing food, because this is a terrible time for very many of our fellow Americans who were living on the edge financially, who could not afford food. And so food parcels and food supply was arranged by our institutions. Also, testing was something that should have been done en masse on behalf of the government. It didn't happen. So a lot of these institutions took it upon themselves to acquire the tests and to do them themselves, so they could inform as many fellow Americans they can that they are infected, and therefore to self-isolate and to protect their family and friends and co-workers, because this is how the disease spread. If you can catch the person who has got a disease and isolate him or her, you have broken the cycle and the trend of spread. Unfortunately, that hasn't happened. And you're talking about care. About a dozen years, about over a decade ago, we saw that despite the fact that we are the richest country in the world, one of the richest at least, and we've got the best healthcare perhaps, yet 50 million of our fellow Americans were without healthcare. So we chose one of the most underserved areas of Miami-Dade County, and we established a clinic there where we had our doctors go there and give volunteer service once a week. Very soon we were recognized. FIU, which is the university that is sponsoring this program, came in and became our partners, and we started giving service from Monday to Saturday. And their professors came, their medical students came, other institutions, other organizations joined us. Today we are leaders in Stop Smoking program with University of Miami. So together with doctors, non-doctors, these were dedicated board members who put their funding for many years. The funding came purely from their own pockets. Then later on, we even went to the community and said, guys, we're doing a great job. We need your help. Because there are so many of our fellow Americans. Like our clinic is in a very underserved area, but these are working Americans who are not too poor to get Medicaid, and who are not rich enough or don't work for a big enough company to get company insurance or healthcare, or they can afford healthcare on their own. And they were left in a limbo. So we decided to provide them care. So our clinic functions from Monday to Saturday, giving so much care. And then we've expanded to a lot more care. We've even joined a national organization called MAVEN, where we can get specialty care. We have found very discounted rate for labs and imaging studies. So we have really become, in fact, now, thanks Ray and Nick, you have also helped us. Your organization has helped us also with funding, and we are grateful. And today we have land, and we are about to build a 22-room facility where we feel that we are here to stay, because when Obamacare was announced, we thought maybe we won't need to do any of this charity care, because every American will get very good care. Unfortunately, that didn't happen. Even today, those who join Obamacare don't get the copay, or the deductible is too high. So we still have this today. Even in the days of COVID, we are doing telemedicine, and we're not letting any of our patients leave without care, because so many other things happen besides getting sick with COVID, and the regular medical care is necessary. I'm sure Dr. Subhani will tell you about she being a frontline doctor, but so many of our Muslim doctors are frontline doctors today, putting their lives online and serving them. And today, the Turkish American community, for example, distributed masks to all the hospitals, to all the centers, to all the community clinics and places of worship. because masks was in such short supply. This is abominable, really, in a country like ours, to be short of masks, to be short of the protective equipment, to be short of testing equipment. This really, unfortunately, all mistakes happen. So we hope we learn from this, because there'll be more pandemics down the road, and we should be ready as a nation and protect our fellow human beings. And not only we have helped the Muslim organizations, but we also work non-Muslim organizations, many others. Like, for example, I've been very actively involved with the Rotary Club. Rotary is one organization that single-handedly has eradicated polio today. Only 2 countries have it. Very soon they'll get a certificate. We'll have eradicated a horrible disease. But anyway, Rotary decided to feed the front line. And we also realized that a lot of restaurants will go under if we don't support them. So we bought food from the restaurants and gave it to the front line. And we supplied thousands of meals to all the surrounding hospitals in our area, because the frontline people, they are working in the hospital, they don't have time to go home, we fed them. And also the first responders. So this is some of the work we have done. And I feel we also made some videos how to strengthen your immune system, because it is important that people understand the truth. There is so much hype and misinformation, like I said earlier. How do we correct that? How do we talk to the people to know what is the right thing to do for you, your family, and your friends? So we have been on that mission. Dr. Subani has been with me on some of these webinars where we talk to the common folks and also to the leaders of institutions, that you are in a capacity, because of your leadership, to influence the other people in your congregation. So we have made sure the imams are educated on what the medical science is saying about this disease. For example, a common misconception, like everybody says, this is just a flu. I mean, they don't know that flu, we have a vaccine and we have treatment, yet we have 35,000 people die in America. And and COVID is 20 times more lethal. So, that is a horrible statistic if it really comes to bear. And people don't know about it, and we don't have treatment or vaccine. And until the vaccine comes or credible treatment comes along, we are all at risk. And our fellow Americans are being served not by the government as it should be, but by the individual physicians and citizens. And we are very glad that the Muslim doctors in the Muslim community has stood up to this challenge and said, we need to do something. We need to get involved, and we need to make a difference to our fellow human beings. Especially, we have such a large medical community, and we brought that to bear. And God willing, we'll make a big difference. And also, so many of us, I know, not just in America. You see, America gave a stimulus package to people because they didn't have enough to live on. But in the rest of the world, especially the third world, these people are daily laborers. They live on daily wages, and what they get is their food they get. If they have no work because there's a lockdown, they starve. So a lot of us went out of way and helped these organizations prevail and supply food to their constituents. So we have not only worked in America, but also worldwide, because we are on in it together, and this is a global pandemic. Hopefully, it'll make a difference. Thank you.
Thank you so much, Dr. Jaffer. You bring up so many good points. One, I think we're happy. One, that you built this facility, so hopefully you will be here to stay. But you bring up so many good points that we'll definitely have to circle back around to, and hopefully we can discuss during our discussion and Q&A. State Representative Duran, perhaps we can move on to you. Can you tell us a little bit about your organization, the Florida Association of Free and Charitable Clinics? What does your organization do, and what collaboration have they also done, perhaps with the Muslim American community here in South Florida?
Good evening. Assalamu alaikum. It's good to be with all of you this evening. And I will, what a time for us to be living in. These are trying times as a community, as a state, as a country, and even for our households. I'm sure everyone is going a little nuts with their kids. If if you have little ones or you're thinking through what school is going to look like and things of that sort. Again, I'm a state representative, but my day job, my work is as the executive director of the Florida Association of Free and Charitable Clinics. And we're a state association that represents free and charitable clinics across the state of Florida. These are clinics that provide free medical services to the uninsured and to the working poor here in the state of Florida. And if you've never heard of them before, you have heard of UHI and how incredibly profound and important it is in their community, but also in Miami-Dade. But we have about 107 members across the state of Florida. And last year alone, we had served close to 230,000 Floridians and served close to about $175 million worth of medical services. So it is no small chunk of change. And really, that's with the support of the state giving, I think, about $9.5 million. A small investment for a mighty, mighty return on investment, I would say. But here's the reality here in the state of Florida, and I think Dr. Jaffer brought it up. We have Obamacare in the state of Florida and across the country. But the way it has worked is that the state has chosen to not the Medicaid program. And so we have close to 700,000 Floridians who are in that gap that they don't make enough money and they're not poor. They're not poor enough and they're making too much money. And so they don't qualify for subsidies in the marketplace and they just simply cannot qualify for our Medicaid program. And so they are basically priced out of a healthcare market. And so these are folks who are working that are making some level of income, but just not enough that when they make their budgetary decisions as a family and as a household, they just simply cannot afford healthcare. And as Dr. Jaffer says, I think our members in this association, the mission is to serve and provide that dignity for families and Floridians who can't do that, but provide them with the dignity of a medical home. And so we as an association bring our members together to coordinate on resource, wisdom, on advocacy, all of these different facets that I think every one of our members does deal with. A lot of them exist because we have a law in place that the state of Florida wisely passed back in 1992 that was a sovereign immunity statute that provides our clinics with sovereign immunity. They step in as an agent of the state if they're serving someone who is uninsured and below 200% of the federal poverty level. And most and every single one of our members has the advantage of that sovereign immunity, and that provides them with the lifeblood, which is the medical professionals who volunteer their time at these clinics to provide their services and to really help a lot of folks across this state. I would say this, when I started back in 2015, our membership was around 82. Of those 82, we had one member at that moment in time, a member clinic, the Muslim American Social Services up in Jacksonville. And they are a fantastic organization up there. Since then, we now have 4 different Muslim-driven community clinics across the state of Florida, serving in the Jacksonville area. You have another clinic out in Tampa. You have one in Central Florida, and we have UHA down here in Miami-Dade. And there are we've had back and forth conversations with several others. And I think what we see and what I know here is that there is a mission to help in your community, no matter what your religion, your creed, what you look like, what your color is, who you love. It is about serving and providing the fundamental, a dignity of having a medical home and ability to be healthy, to be a productive member in your society. And so what we've seen in this in the COVID pandemic as it's unrolled has been pretty tremendous. Once we started seeing it really getting a bit in the high levels back in March, the first thing we started doing as an association was going, what is everyone doing? How are you seeing things? What are you looking to do? And you're starting to see members who would either shut down. One of the reasons for shutting down or not being able to stay open is what Dr. Jaffer said. There was a lack of PPE, of personal protective equipment around the state that was just tremendous. And to even find it, to get it, was something else. And one of the things that association has been doing over the last several months has been securing and working with vendors and working through what is, I think, a wild, wild west, what it was for several weeks and months on purchasing and securing PPE. But working with our members on that. The other thing that we, because you had to close down because you couldn't have access to PPE, what can you do? Because the reality of it is that medical services, somebody's You know, somebody who has diabetes or somebody who has a condition that's a recurring condition, a chronic condition, the care doesn't stop. They need to continue to have some level of medical services. So how and what are we doing, and what was the sort of nimble dance that a clinic was doing to set itself up? So the leveraging technology was a big piece. And we worked with UHI to secure some funds through the Health Foundation of South Florida to help bring in some funding to support telehealth. And really, one of the things that I think is the silver lining in COVID-19 is how much we have foisted and pushed ourselves tremendously into telehealth. Before this, it was talked about, we had passed laws, we had created some level of a playing field. But for this time, I think really with free charitable clinics, the work we've done in Tallahassee on policy related to telehealth, like this sort of really pushed and fast forwarded the entire approach. And so each one of those clinics that I mentioned to you, each one of our Muslim clinics has embraced and is now leveraging technology and using telehealth to maintain and continue services. And so it's been fascinating to watch on that end. But you can see it across the board with our association. You know, there was, you know, first there's the level of shock and concern. What is this disease? What is this? What is COVID-19? What are we supposed to do here? How do we function? How do we say that we're safe? How do we maintain our population of volunteers who are maybe older, maybe more susceptible? How do we make sure that they're safe? But more importantly, how do we maintain our mission? And I think that we saw a lot of nimble movement and smart, creative thinking by members across the state. UHI has been a shining light on that, and the leadership and the team there to continue to do what they're doing has been really a shining light for Miami-Dade and a good example. But that's the association. That's the work that we do. We have the proud privilege to represent each one of these clinics and members across the state that are doing, I would say, the work of the angels, is like I like to say it.
That's wonderful. Thank you, Mr. Duran. And hopefully we can circle back to some of those points that you also raised. Thank you. So Dr. Subhani, let's go ahead and move on to you. If you could tell us a little bit about the work that you and the organization that you are a part of, what has been the response like in the community, and then hopefully we can come back to what your firsthand experience has also been in being in the medical front line.
Yeah, thank you. Bismillah ar-Rahman ar-Rahim. Greetings, everybody. First of all, I wanted to thank everyone, all my esteemed co-panelists. It's really an honor to be sharing this Zoom panel with you guys. We're kind of in this age now where everything is virtual, but it's still a blessing. So we're not going to complain about that. And then, of course, special thanks to the Jaffer Center for Muslim World Studies at Florida International University. It's really been doing tremendous work, and I want to personally thank Dr. Misbahi and then you, Muhammad, for really putting this together. I think information and knowledge is always key in these times. And so it's good to get this information out to the public and then discuss and collaborate. So as we know, just to give a little background, I mean, obviously we know the pandemic response in the US and even internationally, we've had our highs and lows. But in South Florida in particular, we're now the center of national and international attention, and rightfully so, because we're currently the epicenter. I mean, just our latest statistics show that we're at about 380,000 positive cases, confirmed cases, and about 5,500 deaths, okay? And unfortunately, those numbers are growing. They're not diminishing, right? Right when we're having this conference, this call right now, or this Zoom chat, you know, people are really fighting for their lives. Hospitalizations have increased, and we've seen an increase in saturation of not just intensive care beds, but also just regular inpatient beds. And the numbers are going to vary from hospital to hospital, region to region, county to county. But we're seeing the surge now that we expected actually in April. So if you recall back in March when the lockdown went into effect in our Tri-County area down here, and actually throughout Florida, there was an expectation in South Florida that we were actually going to hit high numbers in April. And so many of the hospitals and the first responders and the emergency response teams were actually preparing for that. That didn't happen at that time, but we're definitely seeing the surge now. And obviously the numbers are high for a multitude of reasons. And, you know, many of us know about that. It's been touched upon already by Dr. Jaffer and Representative Duran. But number one, of course, one of the main things is the lack of following the guidelines and the protocols that we should. We've also seen a massive amount of testing that's taken place. So if you recall in the onset of the pandemic in South Florida, you really could only get tested if you had, according to the Florida Department of Health, if you had certain symptoms, and if you were a traveler and you were, there you had a high risk exposure and you were coming in from a high risk country. That has completely changed now. And so now people can get tested sometimes through their private doctors' clinics, through private clinics themselves, like MD Now. Even CVS is offering testing, and then you have the Department of Health testings that are open. Hospitals are offering testing. So people are being able to get tested without having to even make appointments sometimes. So things have definitely changed. That's made, of course, getting the testing process easier, but it does make contact tracing more difficult because you have to keep track of all of these things, right? So apart from that, when we first, just to give a little bit of information in terms of what's happening in the hospitals, about 2.5 to 3 weeks ago, we started to see an influx of younger patients testing that were coming in that were positive. We're talking about coming in with mild to moderate symptoms. That increase we saw going up, and many of them did not require hospitalizations. What you have to remember is that from the onset of symptoms, a lot of times patients don't really manifest at their peaks until about a week into the illness, a week to 10 days. And so we did see a lot of bounce backs coming back to the hospital where patients required hospitalization, oxygen support, and oftentimes even critical care support. But now what we're seeing, unfortunately, is a lot of the elderly population that's being afflicted with the virus because of the exposures. So just to give some examples of things that I have seen firsthand, I've seen youth or young peoples, and I'm talking about not just teenagers, but even people in their 20s or 30s that have gone out, kind of broken the sort of social distancing protocols and these not really taken the mask wearing seriously. And they've been exposed and they've tested positive, and then they have exposed their family members. And so now their parents or their grandparents are falling ill, and they're actually coming in to the hospital in critical condition. And so this is unfortunately some of the trends that we're seeing in the hospital cases. And so, there's definitely a load on the hospital administration because they're trying to balance a couple of things. What they're trying to balance is not just the COVID patients, but then you have the non-COVID patients that are acutely ill and they require care. So emergency surgeries, emergency procedures. How does the hospital maintain safety measures to ensure the patients that are coming in are not exposed? So this adds a whole extra layer of stress, not just the administration, of course, but of course the people that are on the ground, the nurses, the respiratory therapists, the environmental services, security, of course the physicians, the physician assistants. So all of these people that are working together to provide this the quality care to the patients that are coming in. In terms of, just as a general reminder for all of us, there's been kind of a lot of misinformation about how people present with the virus. And so typically people will say, well, it's just like cough, congestion, flu-like symptoms, which is true. That's still very common. But this virus in particular, and we're still learning a lot about it, also you have a lot of atypical presentations. So you have people coming in with gastrointestinal complaints like nausea, vomiting, diarrhea, abdominal pain, but then also peculiar things like loss of taste and smell, which you'll see in about 1/3 of cases of people having that, extreme fatigue. And in the elderly population, we're seeing people come in with acute confusion and mental status change. And you'll see patients in their 80s, 90s that are coming in and they have no fever, no shortness of breath, but they're completely confused and they end up being positive. And I've actually seen, cases, and they're heartbreaking cases because you have elderly patients in South Florida that have home health aides and nurses that come and tend to them during the day. When the elderly patient comes to the hospital and they're testing positive, the question is, where do they get it from? Because even families aren't visiting them. They're being very careful. So what ends up happening is a lot of the aide nurses, they actually had symptoms, but they suppressed them or they did not get tested for fear of losing their job and their livelihood because they are living paycheck to paycheck. So these are just some of the realities of things that we're seeing, on the ground. And we have to obviously address it as a community. In terms of South Florida, one of the things that I just wanted to talk about, it's been an extraordinary response. I think Representative Duran and then also Dr. Jaffer talked a lot about the grassroots efforts, but I really wanted to talk about, the Muslim American sort of healthcare teams that have been out there. They're with everybody else. They're on the front lines. They're serving. Many of them are, at the top of the public health sort of information that's going out there. There are ICU doctors. There's people that are part of the critical care teams, emergency medicine, first responders, surgeons, all sorts of things. And they're providing, partnering with other organizations, obviously serving the community and doing whatever they can to ensure that they're using their skill set to actually serve people. And some of the things that we've noticed on the ground have been remarkable. It's actually just, it's just so impressive, has been the work that has been done to help a lot of the underserved communities that have been hit economically from the pandemic. And so you have organizations like Community Change Makers that works with grassroots initiatives in the local area. So they've actually partnered with Cosmos, which is the Coalition of South Florida Muslim Organizations, as well as 14 other Islamic centers and mosques. And they've actually, all throughout the Tri-County area from April to June, have actually served over 4,000 families with grocery packages and distributed over 3,000 meals, which is remarkable. And just to highlight one particular mosque, because many of the mosques have been doing this, along with synagogues and churches and other houses of faith. But the Islamic Center of Greater Miami, which is in Miami Gardens, they actually did 3 months of lunch meals. So they've actually served approximately 18,000 meals to the community, okay? And they've also distributed food packages to about 1,400 people. They've partnered with other faith-based organizations and local officials. And so you're seeing this incredible partnership and collaborative effort. People are coming together. So sometimes where the government is limited and the government can't reach, you have regular common people that are doing extraordinary things to just help and do whatever they can. And so we've had so many people that have come to the hospital and brought masks, foods, head coverings for the doctors and nurses. And the notes have been just incredible. They're just saying that we're doing whatever we can to help you. So whatever talents they have, they're doing that. So they're bringing meals, and a lot of centers have actually sponsored meals to the various healthcare systems throughout South Florida and really in Florida at large. So we have this sort of remarkable coming together and addressing this pandemic locally and then also statewide. And then I just wanted to end with a few things. I think apart from all of this, we also have to take personal responsibility. So for it's all of us to just do our part to educating ourselves, our family members, and our community on what are the preventative measures to keep ourselves safe and healthy. And so this has to be a holistic approach. Dr. Jaffer has done many presentations and videos on this as well, but really you have to eat well, have meals that have immunoboosting sort of agents or ingredients, antioxidants, vitamins, having regular exercise, sleeping well. I know many of us are on the gadgets a lot because that's all we have, but at nighttime, we really got to make sure those are turned off and you're getting the sleep and the rest that you need. And then also spiritual well-being, because religion is important for many people. Their faith really guides them. And this is an age of anxiety and uncertainty, a lot of cases of depression, and people are definitely fearful, and rightfully so. And this is where having spiritual counseling, having prayer, meditative practices to help with combat these things are important. So this is really a holistic an effort that requires us to really get through this pandemic. And God willing, we will. And then the last thing is just to remember hygiene practices, washing your hands, the social distancing, and then of course the masks. And really, people really should be only going out for what they need at this point with the numbers that are so high. And I recall about 3 weeks ago, I read that the data that in Miami-Dade County alone, that at least 1/3 of the population, according to the testing cases, were positive. And that was 3 weeks ago. And that's just based on test results. There's so many people that haven't been tested that are likely positive. And so this just tells you the numbers are staggering. And so we have to take this very seriously. Thank you.
Absolutely. Thank you so much, Dr. Subhani. Just really quick to our audience, we are receiving a great number of questions. I haven't forgot about you guys, so please continue to send your questions in, and we'll go ahead and have our Q&A session here in just a few minutes. With that, I'd like to go ahead and also introduce with us next Dr. Hussein Negamiya. Dr. Negamiya, if you could tell us a little bit about the work you've done in the Tampa area and what the response has been like there. Hold on one second here, Dr. Negamiya. I believe your microphone is muted, if you can hear me.
Let me see.
Okay, there we go. We got you back. If you could start over for us, please.
Okay, so Assalamu alaikum, peace be with you. It's a great pleasure to be, an honor to be on such an esteemed panel, what has been discussing this very, very important topic of the day, COVID-19. I'm a cardiovascular surgeon by profession, so I'm not a first-line responder, but I have participated in many activities, so to say, especially charitable activities, which have been necessary in order to service the people and the patients of COVID-19. Tampa Bay has not been left behind in their efforts, especially the Muslim community over here. The Muslim community has a very great base in Tampa Bay. We have the charity clinic here. The Tampa Bay Charity Clinic was established in the late 90s. And in fact, I was one of the early members of the clinic. But because of my specialty, I kind of gave the reins to the younger people. Dr. Siddiqui is in charge now. And they see roughly about 15 to 20 patients every day. And again, the patients seen are completely, no consideration is given to any kind of race, religion, or color, or anything of the patient. And the patient is seen. And the clinic is staffed by total volunteers. And of course, 90% of them are Muslim, but lately we have had even non-Muslims join the Red Crescent Clinic in Tampa Bay. This is associated with our largest mosque here, which is the Sly Avenue Mosque. So it became very necessary for us to start the testing of the COVID-19 when the outbreak became really rampant, and especially for the patients that did not have the means of, even transporting themselves to the hospital and stuff. We provided people, volunteers, who would go to the houses of these people and actually test them. Besides that, of course, there was a large, as the COVID-19 became rampant, and then, people started losing their jobs, and people did not have money even to buy food. A great effort was put in by the ICNA Relief in conjunction with all the mosques which are here locally. And we started distributing food. In fact, there are about 15 mosques in the Tampa Bay area, and of course, with the largest mosque, the one in the Sly Avenue, and one in Temple Terrace. The major effort was at these two facilities. And they distributed close to about, the total distribution was between 200 to 300 food packages every day. They produced almost like 15 to 20 pound boxes of fresh produce that was packed in these places. There was a line, actually. I wish I had the facility of sharing some slides with you, but there were lines of these, long lines of automobiles that lined up outside the mosque. They would come one by one. The volunteers would, without, any personal contact, with safe distancing and everything else, they would put the packages inside the trunks of the cars, and then the cars would go away. And this has been going on a continuous basis, almost a continuous basis. And so far, I think they have distributed over 100,000 boxes. They have supplied meals. They have, as I said, done the free testing for the people that cannot afford to either travel or sometimes even come to the clinic. We have a charity organization which we had established a long time ago, which has been holding what's called the Islamic Charity Festival. It has become a sort of a hallmark of Tampa. Every year we hold this, it's under the auspices of what is called the Tampa Bay Muslim Alliance. It's a charitable organization, all funded by donations. And we have been very gracious that, that our political and politicians have been joining in. The mayor is always the chief guest. And we have the honor of having the county commissioners, the chief of police, the chief of fire department, all come to this great event every year. And we serve about more than 1,000 meals. We give away free toys to the kids. We distribute clothes, we distribute shoes, we distribute, everything is free that day. So that organization also became very active within the COVID-19 and started distributing the necessities of life to these poor people. On a broader basis, we have organized, there is a institution to which I was one of the founders. It's called the Negamiya Institute of Islamic Medicine, which has put up a seminar, a COVID seminar, which became live just last week. And we had people from neurospecialty, we had people from family practice, and they came and they gave their views as to how to tackle this very, very difficult problem. And I invite people to come. You go to the www.nims.org, and you'll be able to view this seminar at any time. So all these efforts have been put in. We are very grateful that the Creator, Allah subhanahu wa ta'ala, had given us the opportunity to serve the people. And the Muslim community has really done a tremendous job in the Tampa Bay area. There's another group also, a group called the Doctors for the Emergency Muslim COVID requirements. Now, what has happened is that, you know, even in the mosques, the people had to, for quite a period of time, they had to abandon the services completely. Then we restarted with the safe distancing, with the masks and all that kind of stuff. And I mean, there have been some deaths that have occurred in the community, how to handle the burial, how to handle the dead body and so forth. So these kind of medical questions came up, and this body has been doing this work of advising the people, especially even the Muslim community themselves, as to how to handle the situation. So this is a very important function, I think, and this has been taken care of very admirably. So I think I covered quite a bit of the effort that we have put in the Tampa Bay area. Thank you very much.
Thank you so much, Dr. Negamiya. With that, let's go ahead and just dive right into our question and answers. We are getting so many great questions here from the audience. So please, if you have any questions as we go along, please continue to send them, as well as our audience on Facebook. Please continue to send those in. Mr. Duran, I'd like to go ahead and start with you with our first question, actually, since we have gotten a few. We've really seen a strain on our healthcare system here in Florida. There's been reports that over 50 hospitals have no ICU beds remaining. And one of the questions we received from Betsy Skip, she said, how did a health issue and a global pandemic become more of a political issue? And so I think that might be what some of the audience is perhaps wanting to know. One of the most remarkable characteristics of this crisis has been the absence of a uniform national strategy in dealing with it. And I have Dr. Mesbahi here, who also sent in a question. He says, both in the public narrative and in the policy, quote unquote, everybody is on their own. The authority and responsibility has really moved very quickly from Washington to more of the local level, the state level, and then even within that, the local level. But there seems there's no uniform strategy. Do you think this is a divide based on a deep political divide, or is it actually more of a function of an inability to deal with a public health crisis countrywide or nationwide? And if so, where do we go from here?
That's a lot of
Loaded question.
a thorough question with a lot in there. I'll say it like this, and this is I can say this as someone professional within the healthcare realm, who serves on the board of the Public Health Trust, and who's a father and family man in our community. That it's mystified me how we have sort of just it's like we've rolled the ball of responsibility down the pathways. I really do think that we were missing and have missed a national uniform sort of strategy on all of these levels that really could have helped us really kind of prepare and also absorb what we're dealing with. But there's this idea of kicking it down to the state, and then the state sort of kicking it down to the local municipalities and local governments has really been, it's sort of just been allowing the boat to kind of steer itself. And it's really, really hindered and hurt us. And you see it. And look, here's the thing. The president is a very formative figure. I'm just saying the president, as whoever the president is, people are going to tune in, and a good chunk of people are going to listen and could have take from that person the responsibility and the magnitude of what the issue is. And I always say leadership starts at the top, and if there is no exemplification of leadership of where things need to go and how we steer and how we talk about things, then it allows people to either kind of ignore it and disregard the magnitude and the severity of something. And so I would say to you, I mean, the first question was, how did this become about politics? I think this is just a question of failed leadership, whether you're a Democrat or Republican or whatever. The question is how your president and your government is one of its top priorities to keep people safe. It's one of the utmost priorities of government is to keep its people safe. And we've sort of missed the ball in terms of all of the different things. We ignored the science, we ignored the data, and for that we're paying a severe price. And so we can look at it through a political lens, or you can look at it through a managerial lens. As somebody who is an executive of an organization or a company, you would look at things like that. And it's just, there's all those different checklist boxes that were missed. And so we're now kind of scrambling and paying for it on the other end. I mean, I don't understand how it became a political dialogue about masks. I just don't get where people believe and that's a lot of because of what happens at the top. When the top doesn't convey the importance of something and doesn't provide the message and strength of a message, well, then people are going to question it. And so I think that has been a combination of that has really kind of thrown it at us. And here's the other thing, like this is something that all of us, the mystery of this pandemic, the mystery of COVID-19, right? There's still so much we're trying to learn, it's kind of like building the plane and flying it at the same time. With this, we are doing that. We've missed all of the warning signs beforehand, and now we're really in that sort of mode. So one, I think it's a crisis of leadership, a failure of leadership. And so I think that's one of the big issues. And then the second would be that once people sort of kind of don't take the severity of it in place, we're now trying to really kind of catch up on all those different levels. And so you're seeing it down here when we say, why does it take me 10 days to get a test result? Why are we now worried about testing supplies and things of that sort? I mean, when you think about those kinds of questions, we've had so much time to answer those questions. And we could have had, if a strategy was in place, a sort of trickle down strategy that started at the national level, brought itself to the states and really kind of moved, as opposed to, here, you do what you need over there, you do what you need over there in your state, you know what's best on that end. I think that's something. And so look, in government, there's these competing theories. There's like big government, which is people think of the strong federal government and its ability to sort of quarterback on things. And then others say, no, it's best if you let the states kind of maintain it and mandate it. And then, so there's that level of sort of theory. Let the states kind of do their own thing. They know how to do it. But I think we've learned largely that everybody's sort of been it's undercutting each other's efforts in many respects. That each state has almost competed for things at some points on supplies, on purchases, on manpower, man and women power. It's one of those things. So, you know, I think it starts at the top. Leadership is so critical in a crisis of these magnitudes.
No, absolutely. And I mean, recently our president has put on a mask, so I hope that that'll work to encourage others to hopefully start following his lead. But we'll see what happens there. Thank you so much, Mr. Duran. Dr. Subhani, I'd like to move to you for the next question. We actually have two questions that I'm going to try to combine here because I think they are related. Ms. Zafreen, she asked, what are your thoughts about school openings? How would that affect the surge? What should parents and families do? And I feel like that might sort of relate to Naisi Sardoui's question that we also received. What do we know of transmission from elementary and preschool age children to adults? So combining that, is there a high risk for transmission from kids to adults? And if so, how would that might affect the school reopenings? And what are some steps we could take, or what should some families and what should families maybe be worried about or take steps in order to prevent that?
Yeah, no, those are very important questions. Obviously, there's been a lot of controversy and you know, back and forth about the schools reopening. In terms of exposures in the pediatric population, thankfully, we do know that the children that do get infected from the virus, generally speaking, the vast majority of them do very well and they have mild symptoms. Now, that being said, how infectious are they? And so right now, the right answer is that we really don't know, because you'll have different studies that are coming out and the data is still coming in. I mean, you have some that'll say that the infections rate can be between 8 and 17%. There are some that say, no, it's far less. And so it really, it's hard to determine. Obviously, children that are sick and have, you know, sort of either they've had developmental organ delay, and because of that they've had problems, or they have disease processes like cystic fibrosis, those kids are in a separate category. But generally speaking, healthy children do relatively well. How much they can transmit it to their parents or to their grandparents or other adults, we don't know, and that's where the fear is, because of the lack of data and really understanding. Now, I know that across the pond in Europe, there's a lot of European countries that are working on plans to opening up their schools. I think for us, you know, even to have that conversation, it's going to require a massive effort to see that even if that's entertained, do we have the resources to ensure that the teachers and the other adult staff there are protected, that the children are able to practice, you know, wear the masks and then have the social distancing and have all of those protocols in place. Because obviously there's a lot of factors here at play. It's not just children's education, but also the health of children's. Many parents are worried about their kids actually being at home for such a prolonged period of time. School is a great support system for many of them. So these are things that, you know, they're real considerations. And I know that the CDC has been working diligently to try to come up with safe guidelines and as such. And the only thing that we can say is that in South Florida right now, based on the numbers that we're seeing, you know, it would seem, I would say, cavalier to say that we can reopen at a certain date and do it safely, just because of the massive surge. And so this is going to require a lot of close sort of observation and trends to see what happens over the next coming month. And then, you know, if it requires delaying the opening of schools or having hybrid models, those are things that I think should be discussed. But I think it requires a lot of collaborative working together, sort of threatening schools and doing that sort of thing, or threatening teachers, or, you know, that's very counterproductive, because people have real concerns, and a lot of the people that are working at the schools, so many of them do have risk factors, but if they do fall ill, they can actually potentially die or be really critical. So these things are important for us to address. So I wish there was a simple answer for us to say. It's not so simple, but I think that hopefully we'll be able to get better answers as a lot of the data that's being collected comes out in the next coming weeks.
Thank you so much, Dr. Subhani, for that great answer. Dr. Jafra, I'd like to move on to you for the next question. Obviously, there's a lot of work happening in the South Florida community, especially by American Muslims, in dealing with the medical needs of the community. And as someone who's been here since sort of the beginning, Do you see this effort as a step that could be exponentially expanded in the future? What does it really take to establish a chain of free clinics at a large number and in wider scope? And do you think the obstacle is primarily funding or human resources, or maybe just the will for someone to do it? Dr. Jaffer, your microphone's on mute.
Okay, sorry about that. It's a great question. In a country like ours, we shouldn't have this question. Look at our neighbors, Canada, or look at the European countries, they all have universal health care. So we should not have this free clinic issue in America today. Unfortunately, we have it. And until we get universal care, this was started as a labor of love. But so many clinics have copied us, UHI, all over the country. I have been talking to a lot of people from Seattle to New York and in between, and Minnesota, and they have started their clinics. So we have told a lot of these people, you start in your place of worship. You've got a lot of doctors in your congregation. Let them come and see people on one day or one afternoon or one evening when they are there, and see people for their problems and give them advice. Now, to give that advice without proper examination is also foolhardy, but anyway, it's better than nothing. And they can give them guidance on where to get the proper care. But then ultimately getting a place and establishing your own clinic doesn't take that much. And you're right, it's funding. If the community can generate enough funding and start very small and see how successful it is. And once it gets going and people in the community realize that this is a great source for care, then it expands its footprint. And the people in the community, not just their parishioners from whatever faith they are, but even outside community realize these guys are doing a great job, let's help them. That's where Nick came in and realized that we're doing a great job, because we are one of the very few in Florida, very few clinics that are absolutely free. We don't graduate you depending on your income level. We just want you to say that you don't have care or can't afford care, and we give it to you, and no questions asked. And the state provides us sovereign immunity against malpractice. So that's, I think, baby steps, but it can go like wildfire, and I don't see why every community in this country doesn't have a free clinic until we get universal care.
Yeah, absolutely, and very good points. And hopefully one day our country will be able to get to that point, I hope, with the hard work of people like you. Dr. Negamiya, I'd like to go ahead and move on to you for our next question. And so we actually received a question from Katia Sadakit, and she lives in the Orlando area, and she's interested in the American Muslim community clinics in Orlando. As someone who's from Tampa, what do you think the best way is to connect with local medical charitable contributions in Florida and maybe bring them under a more cohesive and coherent statewide effort or umbrella? And is there room for the Tampa area to combine with the Orlando area as well as the South Florida area?
Well, actually, to my information, there is a Muslim medical clinic, charitable clinic going on. It started its function, I think, last year, and it has got a physical footprint, and it has got volunteer doctors. I don't know per se the address of that, but I could find out and let the people know about it. Now, the Tampa Bay area, we are very fortunate in that sense. Very early 90s, it has grown tremendously now. And we have got established that liaison, and that Dr. Jaffer pointed out that we are affiliated with the University of South Florida. They send in actually medical students to man the clinic and to run the clinic. So there is a cooperative effort, and it is both ways. I mean, they learn and they get exposure to all these patients of various kinds. So a collaborative effort with the local medical schools. Now there is a medical school also in Orlando, so that would be a nice source that perhaps the Muslim community can rely on. But as far as I know, there is a clinic that has been established last year, and it's been progressing because I was invited to their first inauguration, which was kind of towards the end of last year. Now, of course, with the COVID-19 coming, it might have been too much of a burden and might not have taken off as well as it should have been, but I'm sure it will function eventually. And I think these clinics are just, I mean, once you know, as Dr. Jaffer already pointed out, that once you know the running of the clinic and the cooperation, especially, the most important thing that happens is that you need to find out people who will cooperate for lab tests, people who will cooperate for radiology tests and special tests, and the specialists, if some specialist is required. So what we have in the Tampa Bay area is that we have specialists who volunteer to see the patient in their own clinic. They don't have to necessarily come to the free clinic at the mosque, but they give an appointment and they treat these patients free of charge, completely free of charge. So this is an extension of the clinic into the volunteer specialists who do it in their own clinics. So these kind of cooperative efforts can be done. Of course, the administrative capacity is what is required to be run by volunteers. And that is the key. If the volunteers in the administration are good, then the clinic runs very well. And we even cooperate with the Judo Christian Clinic, for instance. We sometimes they send us patients and sometimes we send them the patients. So it's a liaison, and these charity clinics should work in a cohesive fashion. And I think it's a great idea that the Florida state should have all the charity clinics combine and exchange ideas and exchange the resources that have been available to them.
Wonderful. Thank you so much. So I'd like to go ahead. We did receive one question, and I think it's very important, especially for the Muslim community. So I would extend it to either Dr. Subhani or Dr. Jaffer, if either one of you would like to take the helm. So we received a question from Mohammed Farouk, who said, due to the surge in cases, should masjid suspend regular congregational prayers, Friday prayers, and as well as the upcoming Eid prayers? And so I did see actually earlier today an email sent out by the South Florida Muslim Federation and the Imams Council, where an updated recommendations concerning COVID-19 was sent out to the community, and they actually worked with UHI and members of UHI in sort of recommending specific guidelines. What goes into this, and what should Muslims be prepared for with upcoming Friday prayers, as well as the upcoming Eid prayers that we'll see in about a week?
Dr. Subhani and myself were in a conference with all the imams, and I'll let Dr. Subhani give you a synopsis of what went on.
Yeah, it's a good question. Basically, we had a call with many of the imams and Muslim clergy in the area, and we advised them of what we're seeing on the ground and what the risks were, and based on the numbers, just to give them a perspective. We gave them our recommendations that based on the current numbers and the surge, that we felt that for at least the next 2 to 3 weeks, the center should be closed for congregational prayers. And this is only because it's just the risk is so high. And we had this initial shutdown of the mosques when the pandemic first hit, and we were having our cases here in South Florida, and then of course there was a slow reopening. And so now with the surge, we did make the recommendation. And so the South Florida Federation, which basically is an umbrella organization that has a lot of the mosques and Islamic centers under that umbrella, they did put out a statement that gave that recommendation. Many of the Islamic centers will be following that. Those that choose to remain open are going to be following very, very strict guidelines for safety protocols and everything, to make sure that that these measures are in place to reduce the risk of transmission. And so these things are, these are things that we take seriously. And it was a great discussion between the religious clergy and the physicians that were in that conference call, just to answer questions. And also I think Dr. Jaffer would agree, just to dispel a lot of the myths that are out there. A lot of times there's things that are put out in the media and people have a lot of misunderstandings. So they have a clear picture of what we're seeing on the ground.
Wonderful, wonderful. Go ahead, Dr. Jaffer.
Well, Dr. Gurari, there was another question. Thank you, Dr. Subhani. There was another question about stress. It's a very important factor. I think we are gregarious animals, and the social interaction is very vital to our well-being. And being locked down or sequestrated and quarantined and social isolation has separated us from this human contact. Like the meeting today, we see you, but we don't feel you. And that touchy-feely thing is very important part of who we are as human beings. And I made a video on how to handle stress, because there was a very big question that I was seeing in our patient population and also the general public. And it's very important that we are lucky that we have an iPhone with FaceTime or Skype or WhatsApp, where you can see the face of your loved ones, your friends. So I would encourage you to reach out. And like Dr. Negamiya also said about spirituality, it's a very important part. If you communicate with your parishioners, that's why so many people feel like going to the church or synagogue or mosque, because they want that connection again. And we are telling the imams and the priests, you say, look, there's a danger, there is a give and take. My congregational places are dangerous. So there is a give and take, but stress is a very important factor and you must take it head on, otherwise it'll manifest in depression and even suicide.
Absolutely, and thank you. That was actually going to be the next question. I see both, we have a question from Shabir Motorwala and Mohammed Humayunavash regarding stress, anxiety, and as we know, I'm sure everyone watching this can agree, this has definitely been a very stressful and anxious time. So with that, we are a few minutes over. So I'd like to go ahead and maybe just begin concluding. If we could, Mr. Duran, actually, just before we go ahead and conclude, since we did talk about mosque and masjids, do you maybe have any opinion on churches, synagogues, or any other religious places here in South Florida, recommendations for closures? And do you possibly see South Florida going into a full lockdown again? Would that be the possibly only way to stop this virus from spreading or continue to spread?
Sure, and thank you for having me on tonight. It's been great. This has been good dialogue and important dialogue. On the first, on a lockdown, I think it's going to be very tough to get to another lockdown, just because I think our elected leaders are really kind of holding as far back as they can to try to do that. And I think any sort of indication that we're sort of slowing down in numbers or sort of doing anything on that end, I think we should be locking down. I think we have to, at the numbers that we're seeing right now, it just, I think we're just sort of getting at a point where, do we really want this to go away, or do we want to really sort of nip this in the bud and get going? And it seems like we may have no other option but to do that at the moment. Back to with other faith-based organizations, the conversations and the dialogue I've had there, it has been a lot of this, and how do they use Zoom? How do they use technology to maintain to maintain their own congregations? And so I've actually sat with pastors and I've watched them, how they're using Facebook Live, they're using Instagram, they're using a lot of phone calls, a lot of Zoom conferences as their main driver for the time being. On how they are bringing together their members to pray and to engage, and so I think you're going to see that for a while, and I think that's going to be the case over the next several weeks, particularly down here in South Florida. I think that's where we're going. So on those are sort of where I think we are, and I'll touch on one thing only because I had to sit down with a conversation with our superintendent, Alberto Carvalho, down here in Miami-Dade. And he's very good at his job, and probably one of the leaders in terms of putting together what is a rollout for getting kids back into school. And I think Dr. Subhani said it, that for us to think that we're going to have a date certain at this moment in time based on where we are is just, it's a dream. And I think I've heard it in his own voice in what he was saying. He wouldn't say it, and he doesn't want to say a date just now, but with where we are and the numbers that we have in front of us, it certainly is, makes sense that that 26th or whatever that date is that we're supposed to start is probably not going to be the starting date. All that said, be safe, wear your mask, and social distance as much as you can. Thank you.
Absolutely. Thank you so much, Mr. Duran. And with that, I'd like to go ahead and thank our panelists. Thank you all for joining us today. I'd also like to thank all of you in the audience for being here with us today and taking part in this important conversation. It's very important for us to be aware of the community resources we have available locally. So thank you so much for being here. And with that, I'd like to go ahead and conclude the webinar. Please stay safe, stay healthy. You've heard it from the experts right here. Wear your mask, wash your hands, and continue to social distance. Thank you. Assalamu alaikum. And thank you all, and have a great evening.
Thank you.
All right. Thank you all so much.
Thank you very much.